Good afternoon, Facebook. This is Dr. Rebecca Brulette from North Star Chiropractic, and I wanted to just take a couple of quick minutes on this Saturday afternoon to talk to you guys about a patient that I am really excited and happy for. First, she came in to see me because she has been getting headaches almost her entire life. They first started when she was just about 12 years old, and to give you a reference, she's just about in her 30s now. So she has been suffering weekly, almost daily, with pain, debilitating migraine pain. So if anyone out there gets migraines, you can understand this. That she's been dealing with this for forever and never thought that chiropractic was a viable option. Well, I'm excited and happy to tell you that she's been getting, again, amazing results, and I'm going to talk to you a little bit about her case today. So before she came and saw me, again, she's been getting pain weekly. She got about 2 headaches a week, and the migraines were absolutely debilitating. She would notice changes in her temperature of her skin even, and one entire side of her face would be just excruciating pain to the point where she would lose sensation, and skin would feel really cold on one side. And she would try and reach for ibuprofen and was taking upwards of 600 milligrams of ibuprofen every time she felt this headache come on, which again is multiple times a week. So imagine what that's doing to her stomach and to her liver to process through all of that medication. And then she also was taking Excedrin migraine, which again would sometimes even barely touch the pain but wouldn't give her that relief. So she kind of reached out to me as a last resort, again, just living in pain every single day. And this is what she saw. So I'm going to flip you guys over so I can show you. I do a couple of scans in my office which assess their nervous system. Their first one's called a rolling thermal scan, which measures the temperature from side to side on our spine. And the second one is a muscular scan, and that measures the muscles from side to side on our spine. And again, because the spine is in the middle of our body, ideally the muscles should be pulling the same on either side, and the temperature should be the same. So let me flip you around and show you what we saw. You'll see a couple of different colors on the scans, and red means severe, blue means moderate, and green means mild. So this is what we have to work with. So looking right here, this top scan is the one that deals with the temperature differences, and the bottom is the one that deals with the muscular scan. I've drawn in arrows to show you kind of our main areas of concern. Again, we look at the different colors, so of course she has a couple of areas that we'll need to work on. But the main area is this very top bone in our neck, which is called atlas. So I have my little spine model that I can show you. This top guy right here is atlas, and underneath is called axis. It's called axis because it has that little nub here that our top bone can actually rotate on. So what my scans and my exam are telling me is that the very top bone in her neck was misaligned and needed a little bit of attention. So I've gone ahead and written down a couple of the symptoms and things that are associated with that area of our spine. So again, C1 is called atlas, the very top bone in our cervical spine of our neck. And the areas or parts of our body that are affected are the blood supply to our head, the pituitary gland, our scalp, the bones of our face, our brain, of course super important, our inner and middle ear, and our sympathetic nervous system. And possible symptoms associated with a misalignment of that area are headaches, migraines, nervousness, chronic fatigue, and dizziness. So now, the patient has only seen me for 3 short adjustments, and since the very first visit when we addressed that misalignment in the top bone in her neck, she has been pain-free. Did you hear that right? Pain-free, and she's been dealing with this since she was 12 years old. She felt a little bit of a headache start the other day and was able to kind of notice what else was going on, came in for her adjustment again, and is feeling wonderful. So if you guys are struggling with things like this, please reach out to my office. My phone number is 860-759-8848, and I'm excited to have even more success stories and work with you on your health goals. Enjoy the rest of your day, and thanks for learning a little bit more about chiropractic this morning. Bye.